Hi, my name is Hayden Vicary, and this is my 2-minute pitch for Case 1. Just to give a little overview of what this case is about, it's about a 64-year-old woman with multiple sclerosis who is in the hospital. The healthcare team thinks it would be a good idea to insert a feeding tube to assure adequate nourishment throughout the progression of her disease. At first, the patient agrees. However, she becomes disoriented and changes her mind as they are about to insert the feeding tube. So they revisit it the following morning, and she has no recollection of the decisions that she's made the previous day, and she agrees again to have the feeding tube procedure done. The position I've taken on this case is that the doctor should place the feeding tube due to a lack of competence. Now to get into the argument of why I think she should get the feeding tube placed. Informed consent for any medical treatment, not just a feeding tube, requires mental competency. And when the woman regained her lucidity the day after, she had no idea what she said or agreed to from the day before. And any mentally competent individual would easily be able to recall information from the previous day, especially if it was for a pretty involved procedure such as a feeding tube. From the previous 3 claims, I can argue that the woman with multiple sclerosis was not acting rationally and competently to make her own autonomous decisions. With that being said, without competency, the woman is unable to make any self-determined, informed decisions. Therefore, her autonomy is also not valid as well. In the textbook, in the Ackerman article, it states that at times, true respect for autonomy may require the physician to intervene and to deviate from the patient's stated preferences. Paternalism is permitted in this case because of the woman's lack of autonomy and competence. The duty of beneficence also mandates the physician to place the feeding tube in order to act in the best interest of the patient. Insertion of the feeding tube would promote the most good over bad results, and with the feeding tube, the woman would still get the nourishment she needs and requires while her illness progresses. Therefore, I can conclude that the doctor should place the feeding tube due to a lack of competence.